Talofa lava. My name is Debbie Ryan. It's a privilege to be part of this. I used to work as a GP in South Auckland, and I now run a health research and evaluation consultancy looking at improving the health of Pacific people. Together with some colleagues, we undertook some research for the Health and Disability System Review. We looked at international and national research. We looked at performance and health system reports, and we were able to bring together the latest information about Pacific health. It told us many of the things we already know, that Pacific health, the health of Pacific people is not as good as other New Zealanders, and that conditions like diabetes and heart disease are some of the main drivers for that. It also gave us lots of information about what is working well with health services, but as well that in fact the strengths of Pacific people and the hopes of Pacific people to improve their own lives is something that we in health need to consider. My suggestions for the actions that DHBs and PHOs can take based on our research is that the first thing is we need to improve health service delivery. We understand the socioeconomic determinants of health. We've been reporting on this for many years, but we are not making enough difference. And our research shows us there are important things in health services we need to improve. One is people face many barriers to getting the care they need. We call it the burden of treatment. And the research shows us clearly that patients and their families have to manage a whole number of issues related to their treatment. One of these is the cost of care. People who need to see their GPs or their primary care provider frequently may have significant costs. They may also, the individual, have many other conditions, but the other members of the family may also have conditions. And when we talk to families, they show us how many different medications they have to get and how they have to balance every month the cost of whether they get the medication or they pay for basic food items and heating. We in our health services need to be more aware of this. Related to this also in health service improvement is the key role of communication. We all know how important it is to communicate to our patients, not only in terms of giving them information that they can readily understand and not using technical language, but our research shows that even if you don't speak English in New Zealand, your chance of getting an interpreter is less than 5% in primary care. It's unbelievable that we think that we can communicate complex information to patients and not have an interpreter if speaking English is a barrier. This is something we need to pay attention to. The second key point that I want to make is that our approach needs to recognise the strengths of people and their families. Our research found that the National Survey of Wellbeing, for example, that MSD holds, shows that Pacific people have the same aspirations for life, have equal feelings of well-being and life satisfaction to other populations. Sometimes when we present our data, our deficit framing makes us think that people are vulnerable, are helpless, and we don't understand the strengths they themselves can bring to solving the problems. Our research, our interviews with families show that they have many strengths and many strategies for addressing their own needs. And as the research tells us, the patient is always right. The things they say may not seem rational to us, but if we take the time, if we make the connection, form the relationships are really important, we will see that what patients are doing are actually rational to them. So changing our approach so that we're not telling people how to change their lives to how are we supporting them in their reality is really important. And my third big point was, for many years now we have been reporting the same things. We've got to use data, evidence and research to inform best practice, to enable us to monitor our performance so that we can do better for all of our families. Some practical steps for practices or organisations who are interested in doing better for Pacific. One of the great things that has happened in New Zealand over the last decade, certainly since I was in practice, is there has been a real focus on developing Pacific expertise, bringing information about Pacific people together, and the Ministry of Health has supported Pacific provider and workforce development for nearly 15 years now. So these organisations, for example, my organisation Pacific Perspectives, we specialise in collecting data, in doing analysis, in cultural competence training for organisations. There are many others. The Pacific Whanawara provider is called Pacifica Futures. There are organisations of Pacific nurses, for example, the Pacifica, the National Pacific Nurses Organisation. The contact details can be reached through the Ministry of Health website, or we can make it available on this website. But you will find many groups, community groups, primary care organisations, professional groups that you can reach out to help your organisation to develop Pacific expertise.